They are proposing to abolish our healthcare system as we know it.
That's a lie. They want to expand Medicare to cover everyone, not destroy it.
And it is in the best representation of how far the Democratic Party has gone off the rails, in my opinion. They now call it Medicare for all because it sounds good. But in reality, it actually ends Medicare in its current form.
Repeating it doesn't make it true.
It ends private insurance altogether.
That's another lie. Insurance companies sell supplemental health insurance, life insurance, car insurance, house insurance, storm insurance, renter's insurance, business insurance, malpractice insurance. Plenty to keep the CEOs' hefty salaries.
Including for the roughly 180 million people who count on health insurance coverage through their employer.
Another lie. It will reduce the cost to the employer and cover everyone. No one is going to lose.
Everyone, no matter how much you like your plan, would have their plan taken away.
Everyone will have health coverage, whether you can afford it or not.
Instead, you will be put into a government-run plan where you have no say in the cost or in the coverage.
You know what Medicare is. It's the most popular social program in America, and the cost is less to everyone.
Obamacare meant fewer choices. Medicare for all means no choices, no competition.
Who doesn't want Medicare for all? Health industry CEOs that make millions, and donate millions to Paul Ryan.
How much do you get charged for this? That's a good question. A nonpartisan study found that a single-payer program like this would cost the government a whopping $32.6 trillion over the next 10 years.
We spend $34 trillion in 10 years right now. That's a saving of $2 trillion, and everyone has health coverage.
Just to put the price tag of this idea in perspective, we could double all federal taxes, yours, mine, families, businesses, everyone's taxes, and still not be able to pay for this.
We are already paying for it. It's not an extra cost that we will incur.
The only way you could control costs would be to ration care and restrict access to doctors and treatments.
29 million Americans don't have health insurance. We have ration care and restrictions from doctors right now.
All of these decisions would be made in Washington, of course. So even after the failures of Obamacare, this is the direction that the left wants to take our country. Taxpayers paying more to get less. Fewer choices, if any choices at all.
You will no longer have to choose between food and medical care.
Poor quality of care.
World Health Organization ranking of the world's best health systems, Ryan's Better Health Care System is ranked number 37. There are 36 other countries that have better health care than our current system.
All while having the government control this huge part of our lives, such a personal and intimate thing for us. A single-payer system is a singularly bad idea.
Yet it works for most all industrialized nations in the world, with better health outcomes. Norway, Japan, Sweden, Kuwait, UK, Canada, Slovenia, Italy, Finland, Spain, Iceland, Portugal, all have single-payer health care. All of which ranked better in health care than our current, for-profit, health insurance system that leaves millions without any health care.
How much do you get charged for this? That's a good question. A nonpartisan study found that a single-payer program like this would cost the government a whopping $32.6 trillion over the next 10 years.
That's a $2 trillion savings, Paul. Why aren't you telling us that? That's enough to pay for that $1.7 trillion tax cut for the rich that Paul Ryan sponsored and helped pass. These people are not your friends, and they have said that they are coming after your Social Security next. Wake up, people. It's not the Republican Party of 30 years ago. It's now the party of Trump and the rich.